Hi, I thought it would be relatively interesting to record a little bit of a candid video with respect to some of my thoughts. And this has been kind of brewing in my head for quite a few months on how to put this little video together. And it's really taken as a collection of experiences that I've seen when I see my patients in my office. So I'm not going to say this is a pet peeve, but if I had the opportunity to talk to people directly in order to better communicate and get better results, all of these various things, this is what I'd love to say to potential patients. So almost every single day, I get leads that come in, whether they're phone calls or emails or text messages or whatever they may be, DMs. And for the sake of scientific stuff, I go ahead and include when I'm doing any of my publications, whether they be on Instagram, YouTube, what I did, whether it's a dorsal preservation rhinoplasty or whether it's a deep plane facelift or, all of these various terms. Now, one of the things that really I think it's great to be able to put this information out there. And in today's world, we have all of this access to information, which is fantastic. Patients can come in and they're way more educated and have done research before coming to the office, which is fantastic. But there's the other side of the coin of that. And this is what actually happens a lot of times. So we have patients that will come in and say, I think I need a deep plane facelift. And part of this problem is perpetuated by surgeons. I have to say that. It's not a complete unique problem. It's not that this is the patient's issue. This is all parties are somewhat guilty in this. So for example, when we do things like answering questions for patients, I'll get a question that says, what is the best type of facelift? How do you answer that question? I mean, that really isn't a realistic question. It's like saying, what is the best type of car? Well, it really depends. I mean, some people like trucks, some people need a car, some people need an SUV. So the answer to that question is way deeper than just throwing a one-word answer. However, we normally don't get an opportunity to do more than a one-word answer. So therefore, we write out there a deep plane facelift. So therefore, patients get this idea that they need to have the best, they need to come in for a deep plane facelift. Okay? Or they'll come in and say, you're going to do a deep plane facelift, aren't you? And sometimes they're right. Sometimes that is generally what the patient needs. Sometimes it's not what the patient needs. And as I go through this more and more, one of the things that I'm seeing is I get a lot of revision facelifts. So I get patients who've had facelifts in the past. And so I ask them and I say, hey, listen, when did you have a facelift? What did you have? Oh, I had a deep plane facelift. Okay, cool, awesome. And we get an opportunity to operate on some of these patients. So what is a deep plane facelift? Well, a deep plane facelift is you're going to lift partially the skin. You're going to make an entry point into the SMAS. You've got to resect and dissect and release all of these ligaments all the way out to here so that you can lift all the tissues. That's what a deep plane facelift is. Now, I'd say a lot of patients need that type of facelift, but there are some isolated patients that don't. They don't need all that trauma. They don't need all that surgery. Okay? But here's the funky part. This is where this gets even more interesting. So patients that have come and told me, hey, I had a deep plane facelift and I went to this guy, he said he did deep plane facelift. So when you see any type of surgery, there's going to be scar tissue, okay? So when I go through an incision, I can see where the prior surgeon has resected, which is cool. I see the scar tissue and we deal with it. And then when I actually do a deep plane on these patients and go underneath this mass, that plane has never been touched before. There's no scar tissue. There's nothing to show that this plane has ever been touched before. So therefore, I think also a secondary problem in this is that because there is this push and this hype about certain procedures, some physicians say that's what they're doing. In all actuality, they're really not doing that, okay? So if I had an opportunity to really talk to my patients, this is what I would tell them. I think so. I start every consultation out with a couple of words, which is, you have a magic wand. What would you do? Some patients will say, I would like to have a deep plane facelift. Okay. And I stop them right there and go, no, what is it that you're trying to fix? Like, give me your problem areas. Tell me it's my neck. No, it's my face. I really want this lifted. That's what I'm really trying to get to the bottom of. I want to know what it is that bothers you. Okay, whether it be your face, whether it be your nose, whether it be eyelids, whether it be your brow. Once we have an idea of what it is that bothers you, then I can do my exam. I can figure out what it is that you need and what techniques may be necessary in order to achieve that result in the safest, best possible way. So that type of communication occurs only if A, there's complete candor between doctor and patient. The patient trusts the doctor to do the right thing. Doctor has enough experience to do the right thing, knows what he's doing. So all of these givens are there. Am I telling you, stop talking to everybody, every other doctor, and come to me? No, that's not what I'm saying. But if I had an idealized world, this would really, I think, be better, because not every patient needs an ultrasonic rhinoplasty. There are good things about an ultrasonic rhinoplasty. However, there are some bad things about an ultrasonic rhinoplasty. So many years ago, I jumped on the ultrasonic rhinoplasty bandwagon. There's some fantastic things that happened when I did ultrasonic rhinoplasty. I found the fact that these patients, the dissection was so much cleaner. But on the other hand, I also noticed that the operative time for these cases was getting much longer. So everything is a trade and balance. So for example, I'm doing a revision rhinoplasty in a couple of weeks, or actually in a week, and that surgery really does need ultrasonic rhinoplasty type technique. There's so much gone wrong with the anatomy in the past that that's a patient I really do need to use the ultrasonic machine on. So once you achieve a certain level of confidence and professionalism, all those buzzwords and things, you just become a really good surgeon. You recognize that every technique on the planet has pros and cons. And you have to find the technique that truly fits the patient's anatomy, the patient's concern, and what's best for that patient. There is not a one size fits all. And I think this is where a lot of this research has really gone. So what has happened is, the great thing about research is that patients are able to go on to places, YouTube, Google, all these different things, and learn a lot about these things. The problem with it is, a lot of doctors jump on the hype bandwagon and don't really deliver the appropriate procedure for the patient. And this leaves this kind of sour taste in the patient's mouth, and it becomes this kind of a snowball rolling down in an avalanche, because they feel they need to now do even more research and control that narrative even more, that the more research they do, they'll get a better and better result. Where in actuality, what it really was is it was an incompatibility between doctor and patient. So these are a couple of my candid thoughts with no filter. I hope this helps you. And I'd love to see you, but make sure that the communication that you have with your surgeon is really that simple and that candid, because I think that this is really important to achieving appropriate natural results in patients and getting consistent results, and not either over or under operating on a patient. And I think all of this together is the essence of what I like to call Authre Beauty. We use a hashtag very frequently called Authre Beauty, and it's a very nebulous word. And these are all the little ideas that I think I build into that. If I could give potential patients an idea of what Authre Beauty really means, it's kind of all these little things jammed into this one idea. So thank you so much for listening to my rants, and hopefully this helped.